Welcome to Hidden Costs, where we uncover the invisible dangers within our world, waiting to change human history forever. Deep within the shadows of these ancient tropical forests, a silent predator awakens, carrying a biological weapon that threatens us. They take to the skies at dusk, unknowingly carrying a microscopic killer that the World Health Organization fears the most. This pathogen is not famous like COVID, nor is it as common as the flu, but it is far deadlier. It lurks in the corners of Southeast Asia, waiting for the perfect opportunity to jump from its animal host to humans. In these quiet villages, the boundary between human civilization and wild nature is blurring, creating the perfect storm for disaster. When it strikes, it does not give you much time to say goodbye to your loved ones or seek help. The mortality rate is terrifyingly high, ranging from 40 to 75%, depending on the strain and medical care available. Doctors fear it because they know that for many patients, there is simply no cure and no specific treatment available. It has the potential to stop the world in its tracks, just like we have seen in recent global history. Its name is Nipah, a word that sends shivers down the spines of virologists and epidemiologists all around the globe. One single drop of contaminated fluid is all it takes to start a chain reaction that could kill thousands. We live closer to these creatures than ever before, inviting a danger that our immune systems are not prepared for. This is not a fictional horror movie scenario. This is a real medical emergency happening in our world right now. Join us as we dissect the anatomy of this killer and understand why Nipah is called the silent pandemic threat. To understand the enemy, we must look closer. The Nipah virus belongs to the dangerous family known as Nipah virus. It is a close cousin to Hendra virus, another deadly pathogen that jumps from animals to humans with ease. Scientists classify Nipah as a zoonotic virus, meaning it naturally transmits from vertebrate animals to humans in specific conditions. The natural reservoir for this virus is the fruit bat, specifically the Pteropus genus, found throughout Asia and Africa. These bats carry the virus without getting sick, acting as long-term vessels that spread the pathogen across vast distances. Once inside the human body, the virus acts quickly to hijack our cellular machinery and replicate itself at speed. Unlike respiratory viruses that stay in the lungs, Nipah has a terrifying ability to travel throughout the entire body. What makes Nipah truly unique and frightening is its dual attack mechanism on both the respiratory system and the brain. It targets the endothelial cells lining the blood vessels, effectively breaking down the barrier that protects our central nervous system. Its genetic structure allows it to mutate, although it is currently stable enough to cause consistent and deadly outbreaks. Handling Nipah requires the highest level of biosafety, known as BSL-4, because a single mistake could be fatal. Scientists study these samples with extreme caution, knowing they are holding one of the deadliest pathogens known to mankind. The spillover event usually happens when bat secretions contaminate food or water sources consumed by domestic animals like pigs. Pigs act as an amplifier host, replicating the virus in massive quantities before passing it on to human farmers. This transmission chain from bats to pigs and then to humans was the key to the first major outbreak. The virus causes severe damage to tissues, leading to systemic inflammation that overwhelms the body's natural defense mechanisms. For years, it remained hidden in the jungle, a neglected tropical disease that the modern world largely ignored. But everything changed in the late 90s when the virus decided to step out of the shadows and attack. The storm was brewing over a small village called Sungai Nipah, the place that would give this virus its name. This small community had no idea that their name would soon become synonymous with a global medical emergency. Life continued as normal, with farmers tending to their livestock, completely unaware of the biological time bomb ticking nearby. Simple daily interactions with their animals became a game of Russian roulette with deadly consequences for the entire region. This sets the stage for the first recorded catastrophe, a medical mystery that baffled scientists and terrified a nation. In 1998, Malaysia witnessed a strange and terrifying disease that defied all initial explanations. It started in the pig farming communities, where huge numbers of livestock lived in cramped and unhygienic conditions. Farmers began to fall ill with high fevers and confusion, collapsing in their fields and homes without warning. Local clinics were quickly overwhelmed, and doctors initially thought they were dealing with Japanese encephalitis spread by mosquitoes. They spent months fogging villages to kill mosquitoes, unaware that the true culprit was spreading directly from the pigs. But then they noticed the pigs were sick too, suffering from a barking cough that echoed through the farms. A young researcher finally identified the virus, realizing it was not mosquito-borne, but a direct animal-to-human transmission event. Panic spread across the country as the death toll rose, and the government realized they faced a national crisis. Over 265 people were infected during this outbreak, and families watched helplessly as loved ones died. 105 people lost their lives, a tragedy that devastated the farming community and shocked the world. The government had to make a brutal decision to stop the spread, mobilizing the army for a massive operation. Over 1 million pigs were culled and buried in mass graves to break the chain of transmission. It was a heartbreaking scene as farmers watched their livelihoods destroyed to save the rest of the human population. The outbreak caused an economic collapse in the agricultural sector, proving that health security is also economic security. Ghost towns emerged where thriving farms once stood, leaving behind a scar on the landscape that remains today. But while the pigs were gone, the bats remained, retreating back into the forest, carrying the virus with them. The world thought the danger was over, but scientists knew this was just the opening chapter of a longer story. The virus had also reached Singapore through imported meat, proving that borders cannot stop a microscopic biological enemy. International cooperation became essential as health officials raced to understand how to contain this new and deadly foe. The Ambior outbreak ended, but the lesson was clear. Nature has weapons that we are not ready to fight. But what exactly does this virus do to the human body that makes it so incredibly fatal? To understand the horror of Nipah, we must look inside the most complex organ of all, the human brain. Nipah is not just a respiratory disease, it is a neuro-invasive pathogen that attacks the control center of life. It crosses the blood-brain barrier, a protective shield that usually keeps viruses out, and begins to cause inflammation. It starts deceptively like the flu, with a sudden high fever, muscle pain, and a severe sore throat. But soon the headaches become unbearable as the brain tissue begins to swell inside the confines of the skull. Dizziness turns into confusion and disorientation as the virus disrupts the electrical signals firing between neurons. Doctors call this encephalitis, an acute inflammation of the brain that can lead to permanent damage or death. The seizures become frequent and violent, signaling that the virus has taken complete control over the victim's central nervous system. Within 24 to 48 hours, the patient can slip into a deep coma from which many never wake up. This combination of brain inflammation and respiratory failure creates a lethal trap that modern medicine struggles to unlock. Even for the lucky few who survive, the battle is not over, as long-term neurological side effects are common. Survivors may suffer from persistent convulsions and personality changes, effectively losing who they were before the infection. Medical experts describe it as a pathogen that does not kill you slowly, but shuts you down like a switch. In the isolation wards, Patients die alone, separated from their families by glass walls and layers of protective plastic. The medical staff do their best, but without a specific antiviral drug, they are fighting a losing battle. This microscopic organism is a perfect biological machine designed to exploit the vulnerabilities of the mammalian nervous system. The damage it leaves behind is extensive, turning healthy brain tissue into damaged scars that can never fully heal. It is a humbling reminder of our fragility and the limits of modern medicine against nature's most aggressive creations. But the story gets worse. In South Asia, the virus evolved a new way to hunt, human-to-human transmission. As we move our focus to Bangladesh, we discover a different strain and a terrifying new route of infection. This is where Nipah transforms from a rare animal disease into a potential driver for a global pandemic. In Bangladesh, the outbreaks are often linked to the consumption of raw date palm sap, a local delicacy. Bats love this sweet sap too. They drink from the collection pots at night, urinating and defecating into them. Unknowingly, people drink this fresh sap the next morning, ingesting massive loads of live virus directly into their bodies. This route of transmission is incredibly efficient, bypassing the need for an intermediate host like the pig. But the real nightmare begins when these patients return home. Family members caring for them start to get sick. In these outbreaks, we see clear evidence of human-to-human transmission through saliva, respiratory droplets, and bodily fluids. Hospitals in rural areas often lack isolation wards, allowing the virus to spread from patients to nurses and doctors. While the Malaysia strain was not very contagious between humans, the Bangladesh strain has shown an alarming ability to spread. Even after death, the body remains infectious. Traditional burial rituals involving touching the deceased have sparked new clusters. We have documented chains of transmission where one patient infects their spouse, their children, and even their treating physician. In the Siliguri outbreak in India, 75% of cases were hospital staff or visitors, proving its nosocomial potential. Witnesses described it as a war zone, where doctors were falling ill alongside the patients they were trying to save. The mortality rate in some of these outbreaks has reached a staggering 90%, leaving almost no survivors. Authorities have to implement strict lockdowns, sealing off entire houses to prevent the virus from escaping into the community. Fear permeates these communities every winter, which is the season when the date palm sap is harvested and consumed. Nipah is not a one-time event. It returns almost every year, striking different villages like a recurring nightmare. Scientists are now racing to install cameras and protective skirts on trees to stop bats from contaminating the sap. Simple solutions like covering the pots with bamboo skirts can save lives, but changing traditional habits is difficult. Culture and tradition often clash with safety protocols, creating weak points that the virus is all too happy to exploit. The biggest fear is that an infected person travels from a remote village to a megacity like Dhaka. If Nipah reaches a megacity, containment would be nearly impossible, and the death toll could be catastrophic. This scenario keeps epidemiologists awake at night, knowing that we are just one mutation away from disaster. We live in a hyper-connected world where a virus can travel from a village to a global capital in hours. Why does the World Health Organization list Nipah as a priority pathogen with pandemic potential alongside Ebola and Zika? It checks all the boxes for a global threat: a wide animal reservoir, high lethality, and respiratory transmission capabilities. The fruit bats that carry Nipah live across a massive area home to more than 2 billion people. As we destroy their natural habitats, these bats are forced into our suburbs and cities, bringing the virus with them. Wet markets and urban expansion create the perfect interface for spillover events to happen more frequently than ever. RNA viruses are known for their ability to mutate. It only takes small genetic changes to make it more contagious. Imagine a virus as contagious as COVID-19 with the lethality of Ebola. That is the nightmare scenario. In 2018, an outbreak in Kerala, India, proved that Nipah can strike in unexpected new locations. A heroic nurse named Lini paid the ultimate price, reminding us that healthcare workers are always on the front line. Global health security relies on early detection, but Nipah's initial symptoms are generic and easy to miss at borders. The incubation period can last up to 45 days, meaning a traveler could carry the virus across the world undetected. A single infected passenger on a long-haul flight could theoretically spark outbreaks in multiple continents simultaneously. Despite the danger, research on Nipah is underfunded compared to other diseases, leaving us vulnerable and unprepared. There is currently no approved vaccine for humans and no specific antiviral treatment available on the market. Big Pharma has historically ignored it because outbreaks are small and sporadic, offering little financial incentive for vaccine development. Fortunately, organizations like CEPI are now stepping in, funding research to create a defensive shield before it's too late. Experimental vaccines are showing promise in animal trials, but we are still years away from mass production for humans. It's a race against time. Nature is evolving faster than our science, and we cannot afford to be complacent. The virus does not care about borders, economies, or politics. It only cares about survival and replication. Our urbanized, interconnected world is the perfect petri dish for a virus like Nipah to thrive and conquer. The question is not if another outbreak will happen, but when and if we will be ready to stop it. From the deep jungle to the modern hospital, every link in the chain must be strengthened to prevent catastrophe. So what is humanity doing right now to stand against this silent killer lurking in the shadows? Virus hunters are working tirelessly in the field, tracking the virus in bat populations to predict spillover events. Surveillance systems are being improved to detect unusual sickness in animals and humans faster than ever before. Education is our best defense. Teaching communities to avoid raw date palm sap and wash fruits can save thousands of lives. Simple behavioral changes like using protective skirts on sap collection pots are proving to be effective low-tech solutions. Hospitals are conducting drills to ensure that if a patient arrives, they are isolated immediately to protect the staff. The success of mRNA technology during COVID has accelerated the development of candidate vaccines for the Nipah virus. Monoclonal antibodies are also being explored as a potential treatment to give patients a fighting chance against the infection. Global leaders are finally realizing that investing in pandemic prevention is cheaper than paying for the cost of a pandemic. The One Health approach is gaining traction, recognizing that human health is inextricably linked to animal and environmental health. Protecting nature is protecting ourselves. Restoring bat habitats keeps them in the wild and away from our farms. Every step we take today helps ensure that the next generation does not have to face a devastating Nipah pandemic. However, we must remain vigilant. The virus is still out there, evolving, waiting for us to make a mistake. It only takes one spillover event, one missed diagnosis, or one flight to turn a local outbreak into global chaos. We have the tools and the knowledge to stop it, but do we have the political will and global unity? Nipah virus is not just a story about a disease, it's a story about our relationship with nature. It's a reminder that when we encroach on the wild pushes back with deadly consequences. The bats will continue to fly,
and the virus will continue to exist. The variable in this equation is us. The next pandemic does not need to be created in a lab. It may already exist in a drop of sap. Our safety depends on respecting the boundaries of nature and investing in the science that keeps us safe. This is a hidden cost of our modern lifestyle, a price we must acknowledge before the bill comes due. Thank you for watching Hidden Costs. Please subscribe to our channel for more investigations into the silent threats around us.